Jim Joyce.
There we are. We made it. Another Wednesday. What are we,
And
60 something episodes? What are we, what's the number?
no, man, we're in the 70s for sure.
Whoa.
Yeah. I know we had like the kickoff, and I forget, I was looking at the megaphone dashboard for podcast stuff, and I think it's at 75 or 76. Right. But that includes, I think, like our kind of kickoff and then another little blurb. So no, we're in the 70s.
We're like the longest standing podcast. So talk to us about the gangster sunglasses here, or the.
Oh, it's just So I'm in the garage. In a different spot because right. I actually got a number of emails last week because we lost our streak, but in honor of Marina's mom. So not to make this a somber, but we're now packing everything here. So we're back in the garage. Here it is. And it is pretty sunny out there. And so I put my, pit bull glasses on. That's me. And I'm going to just quickly show, like, there was this thing, it's craziness. And this is my little setup with a bucket and stuff. Oh my God. Yeah. So anyway.
So first of all, best of thoughts to the family. We've all been thinking of you. So
thank you. Yes.
Warm thoughts and, in the tricky time you're in. So good to see you again.
Yep, exactly. Thank you very much. I honestly, I haven't even been looking at the news. I've been like heads down between your coach stuff and which is nonstop and then all the home stuff. So
didn't you feel like even unplugging for a week around this thing kind of took you out of the game a little bit? Like, is this like,
I missed it. I missed it. Like, I look forward to that Wednesday, and I know we'll talk more. Right. I know I'll see you literally in a couple of weeks, face to face, I think, in Boston for the HealthXL DTX event.
Yeah, we'll be gathering. In Boston. Yeah, we'll be in Boston, and then we'll be in Dublin together. Like, is that the plan?
Dublin, yes. That's the plan. So October 28th, Dublin. But yeah, like back to just I missed the Wednesday was like the week was just like weird without it.
So a bit of pace, right? It's a bit of pace, man. It's a bit of pace, right?
Yeah. Exactly. Well, if you don't have any other news, I don't know if anything happening on your end. We do have now. This is somebody who we've been kind of stalking each other on social media, for lack of a better term, and we finally caught up this week. And I was like, oh my God, you're just full of energy. And I'm gonna admit her. And we've now had, from all walks of life. We had nurses, we had VCs, we had entrepreneurs, and so looking forward to speaking to Risa Vatanka. So I don't know, I think she is probably about to do her video, hopefully. Right. Let's see
if we get there.
There she is.
Hey.
Hey.
Nice to meet you, Risa.
Yeah, nice to meet you. This is fantastic.
So I'm a fan. Thank you. As you were coming on, I was saying to Jim that you and I have been kind of like social media stalking a bit, and then we had a call, and I remember texting Jim. I'm like, this is the energy that we need on Wednesday. So here you are.
Before we go anywhere, that's officially the best pair of glasses, Risa, that we've seen on the podcast. We've had 70 episodes, right? What do you think, Eugene?
Yeah, I agree. Well, maybe, I know those are glasses, my pit bull look is, a little different.
Well, and because I have stalked you all, I'm going to say that those rose-colored glasses that Jim wore, pretty spectacular.
Yeah, I have a soft spot for rose-colored glasses, right? That's how we see the world.
At least on these Wednesday things, on the shot, right? So, and then the rest gets in. But why don't, for the millions of viewers and listeners, Risa, take us a little bit through your journey. I was just starting to say that we've had all different professionals on this podcast, but I don't think we've had a pharmacist. Oh, you're right. Okay, you're right.
Who did you
have? Leonora O'Brien. Do you know Leonora? Yeah, I don't know but we'll connect you guys up anyway. But we haven't had a California Farsi speaking from St. Louis Indian Reserve. I just listened to a little bit of research. So we've had no one like you.
As you noticed, Jim is very meticulously unproduced. So he does his Googling right before. But anyway, take us through it. How did you get into it? What's your story? And then we'll peel it apart.
Yeah. So let's see. So who am I? As you know, I'm a pharmacist. I'm a digital health enthusiast. I'm a mom. Like you said, I grew up in St. Louis, Missouri. And then when I was 6, I had the opportunity to move to Iran, and which was fantastic. So I speak Farsi, as you pointed out, and really got in touch with my language. I was there for about 3.5 years. It was really formative. And then back to the States for the rest of my experience. I went to pharmacy school in the Midwest, KU. Okay. And then I always like to mention some of my kind of early experiential and postgraduate experiences, because I really feel like I know that it changed the lens, speaking of glasses, changed the lens through which I have seen what pharmacists are capable of and how we can contribute to the healthcare ecosystem. So when I was in pharmacy school, I spent 2 summers with the United States Public Health Service, Indian Health Service.
Oh, wow.
Yeah. And so one summer I was on a Navajo Indian reservation in Shiprock, New Mexico. And, anytime you are working in an environment where it's kind of underserved, each healthcare provider works at the top of their education and training, right? And so in those, formative years, I saw where, they were already, we're talking about health and technology. Let me just share with you, I'm just going to go granular for a second, because this is this really
We got amazing. Time.
Good time.
So, back then, right? So this was like in the early 90s, but I know that it had been going on for decades before that. When a patient would come into the clinic, first stop was at the front desk to pick up their medical chart. And they carried their medical record from x-ray to lab to their physician visit to the pharmacy. So when they got to the pharmacy, they didn't hand us just this little piece of paper, or like today with e-prescribing, just kind of like a few notes about, what the medicine is. The pharmacist had to open the chart and look through and see what the diagnosis was, what the lab was, what was going on. And so really, it just really amplified our ability to really understand what's going on with the patient and look at the medication, not in a silo, but within the total context. And so, and it was really a team-based approach to care and very patient-centered. When they would go to the window to hand the medication out, they were very, it was interactive patient consultation. They'd even sit in a patient, you'll like this because of like Eugene with all the, more health promotion, disease prevention type things, they'd sit in a patient care room with the patient and their family. Right. Because they knew maybe the husband has diabetes, but the wife's doing the cooking.
Right.
Have this kind of comprehensive conversation.
I'm going to interject real quickly. And when we caught up, what really just was this aha moment, which it kind of, I knew it, but you said something. This was when Risa and I just caught up earlier in the week. She said something like, when a patient walks in and needs some kind of a OTC pill, a good pharmacist doesn't just send them to an aisle, which I think that was you, right? That pharmacist actually asked the question for what and context and more holistically. You can probably do much more to this story than I can, but it just resonated.
Yeah, for sure. In the days when I was in the front lines working in community pharmacy, it didn't matter how busy I was, right? In terms of filling prescriptions, the fax machines, the giving vaccines, all different things. When someone would come to the counter and ask for an OTC, like where's the Tums or something, it was never aisle 2 on the left in my pharmacy, because I felt like that was probably the most important thing I could do in that moment, because it's probably the port of entry in the healthcare system. They may have spoken to no other healthcare provider, right? So I would take the time to go out there and do a little triage, because maybe Tums was a bad idea. Maybe they've got a bleeding ulcer and they actually need to go get scoped and come back with a prescription, So, that's how I did things. Now, I know that, that takes missionary zeal. Because it is such a busy, rapid pace environment. So, it's all pharmacists want to do that. It's just really challenging. And, that's one of the things that I'm hoping that we can really change the pharmacy model to make it where that people can benefit from, their pharmacists be able to have that time.
And before we go, just stay with that for a second. Like, how do you deal with, I feel like when you go to a pharmacy, like when you think about going to a pharmacy and you're looking for that OTC medication, or you're talking kind of in a public venue to a pharmacist about whatever ailment, you're very vulnerable, right? And you might be embarrassed, or you might be, you're dealing with something that, how you look, or this, or, like, what's the technique? Like, how do you take people's anxiety down?
That's interesting. So certainly, if something turns into a sensitive conversation that you shouldn't really be having in the aisle, then you can welcome them over to a more private area near the pharmacy.
Right.
Today our pharmacies more and more have consult rooms or some kind of privacy area because we give immunizations. So I think it's just a matter of stepping aside. Yep. Look, we are the most accessible, most frequently visited healthcare provider, right? 90% of the US population lives within 5 miles of a pharmacy. So huge access point, and you'd be surprised. People are very happy to
share their problems.
And how many pharmacists roughly are there in the United States of America?
I think there might be 300,000 of us. If I'm
right.
That sounds about right.
Something like that.
Yeah, that sounds right.
But should I share a little bit more about my experiential?
Yeah, let's keep moving. Yeah.
So, so certainly Indian Health Service, extremely formative, and then I also worked with the Assistant Surgeon General, out in DC, where I got to, and they were running, he was also the head of Indian Health Service, so I got to really see the behind the scenes of how they were supporting, the pharmacists out there. So really great early experience. Then what I did, so for physicians, it's required to do residency training to practice, right? For pharmacists, it's optional.
Okay.
And it's becoming more and more prevalent, right? More and more opportunity in that way. And so I did a postgraduate residency at UCSF, University of California, San Francisco.
Lovely.
And a postgraduate residency at Stanford. And only want to mention it because when you're in university teaching hospitals, again, another area where, it's more team-based approach, and all healthcare providers, really patients benefit, right? Patients at the center, and you kind of have this interprofessional approach to care. And so early on, I saw that when I was at UCSF, rounds didn't start till I was there, right? So when the bacterial cultures would come back, then the attending would say to me, okay, so what's the best antibiotic and how do you want to dose it based on the person's renal function? So wow, like really team-based. Or like when I was in the clinics at Stanford, we would see patients the same time they were seeing their physician. We'd look through, we'd do kind of a chart review to look for any medication-related problems, potential issues, and note those, and then the physician would check with the patient, or maybe the physician would send back to us. So it was just this really, I'll say it again, just a team-based approach. And anyway, it's really inspiring to me. So after that, I thought, okay, so what am I going to do out of residency? Should I go work in a health system? I could. I thought, why are we waiting until people are really sick before they're benefiting from pharmacists on the care team? So I decided to really dedicate my career to advancing community-based pharmacy.
Okay. Wow. And so and when you say community, so dedicating your career to community-based pharmacy, do tell, what does that mean?
Yeah. So it's like your neighborhood pharmacy, right? Okay. I think the reason that the pharmacist role in health system evolved, more rapidly was, at the end of the day, everything's relationships. We were right there in the same location with the other healthcare providers, right? And we had access to the data, right? Yep. So the labs, the diagnosis, all of that, right? So I think that clinical pharmacy really grew in the 60s, 70s, it really started to blossom. In the community-based pharmacy, we're the same pharmacists, we have the same education and training and all of that, the same heart, we want to care for our patients, but we don't always have the data. We don't have the labs, the relationship of, running into somebody in the hallway or the elevator.
Let me poke a little bit here, right? Because, and I know we caught up, I've spent some time at a PBM where a pharmacist is a bit of a machine. So yes, it's highly enabled by data from all kinds of sources, but it's also highly scripted to a certain extent, where I think in a community pharmacy, while you may not have all the labs data, you're seeing the same patient every week. And so the data, while it might be in the pharmacist's brain, it's knowing that individual, that person, right? And I think, again, I'm not saying one way is better than the other, but I would just challenge that data exists in that pharmacist relationship versus a non-relationship culture in a PBM or a more industrialized processes.
I knew I liked you, Eugene.
Okay. Whew, I passed the test.
No, yeah, absolutely. Again, the most frequently visited healthcare provider, most accessible. Like when I would, so when I was working in the pharmacy, I used to call myself an adventure pharmacist because I'd float to pharmacies throughout Northern California and even Hawaii. I had a Hawaii license as well. But what you found is that, the pharmacists and the pharmacy technicians, they know their community, right? So they'd be asking about, they were at, so-and-so's kid's basketball game over the weekend, and how did this go, or their football, so it was just you're right, it's that whole relationship. And when Mr. Jones comes in and he doesn't have that same kind of bright smile, you kind of know something's going on and you're going to ask. You're right, it's right. That definitely that human relationship and that kind of connection with the community. And that's what's really been exciting. All the advances we have made in community pharmacy, I think it is that it's kind of see what we talk about with digital health. Why am I a digital health enthusiast? Why I'm so excited about it, right? It's because we go from this kind of chaotic episodic care, right, to this more proactive, continuous care in real time. And I think the closest thing we've had to that, if I may, up until now, is the community pharmacists. Because we do, maybe they see the physician once or twice a year, but they are seeing their community pharmacists, they're there monthly, they're in their grocery shopping.
Yep.
You can stop by and ask questions.
Wait, we can't just go swinging by that you were Hawaii, and we got to stop in Hawaii for a second here. Like, were you treating surfers, or, we just can't swing by that. Like, bring us to Hawaii.
Yeah, I missed part of what you said, but you want to know more about the Hawaii experience?
Totally. Because I have to tell you, I was just surfing this weekend. I went surfing in the west of Ireland this weekend with our buddy Martin Kelly. We didn't tell you that.
There we go.
So first of all, did you try surfing? And then second of all, give us like a Hawaiian story.
Yeah. Oh, wow. Wish I surfed. I snorkeled.
That's cool.
All right.
And I have a fun picture. Too bad I can't just show it really quickly, but I've got a picture of me in my white coat in the pharmacy, and I've got a snorkel in one hand and a counting tray in the other.
That's perfect.
Hey, that's pharmacy.
You'll have to post that on the comments of the LinkedIn post. Right. There we go.
I will definitely find that. But yeah, it was brilliant. It was amazing. I was on the Big Island, on the Kona side, and you were only allowed to work 4 days a week. So then I had to travel around the island the other 3 days.
Brutal.
Oh, no.
Brutal.
I feel so bad for you. So fast forward, your commitment to community pharmacy is, so when did you join? So I know, obviously many people know AMA, the American Medical Association. Maybe talk a little bit about APHA. Am I saying that correctly? Okay.
Yeah.
Who is it for? Who is it by? How did you get there?
Yeah, I love how you start with AMA, because I often will explain, like at a dinner party, I'm like, well, AMA and ADA, ANA, we're APHA, right? So we are the oldest, so it's the American Pharmacists Association, and we're the oldest, largest society of pharmacists representing pharmacists across all practice settings.
Okay.
And we've got a really amazing headquarters in Washington, D.C. Here's a little bit of information. Little trivia. So we're the only non-government building on Constitution Avenue.
Ooh.
All that land used to belong to a pharmacist.
Wow.
Yeah, and then when he kind of gave it to the government, or however that transition happened, he carved out a spot for the American Pharmacists Association. So our building is a historic site, and from our terrace, you can see the Potomac. It's right across, just right there is Lincoln Memorial and Washington Monument and the Capitol Building. People have weddings and big events on our terrace. And some years ago, we added onto the building. And so 6 more floors, and the State Department rents several of our floors, and their main building is just right behind ours. So so that's a little more about
that's pretty cool. And how often are you there?
Yeah. Well, pre-pandemic. Yeah, maybe 4 times a year or something like that. Okay. Depended, if things were going on. But yeah, I haven't been there since probably 2019.
I was supposed to be in, there was a was there an event, National Association of Specialty Pharmacy, that was supposed to be in DC this past weekend?
Yeah.
Yeah, that's right. So yeah, but anytime it got canceled because of everything going on. But did you feel like when you go to DC, like the buildings are so big, they're so amazing that if you've lived outside of the US for a while, you feel like you're in kind of some kind of Roman, like it's just such a tribute to itself, isn't it?
Yeah, it is pretty incredible when you land at Reagan, and then like the Uber or whatever like whisks me over to the APHA building. Right. I kind of, it feels kind of cool for a while. I'm like, oh, this is what news starts feel like. Yeah, it's kind of got this. Yeah, but yeah.
So what's the what's the mandate of APHA? All right, I mean, representing pharmacists around US only specifically, or global organization, or
so I will say on this podcast I'm not representing APHA officially. I'm just here as an enthusiastic pharmacist.
Cool, energetic Risa hanging out with Eugene and Jim Joyce.
With cool, energetic Eugene and Jim. But so with that, we're really, look, do you know that it's there was a study and it showed that non-optimized medication therapy costs us something like $524.8 billion annually, which in 2016
24.8.
yeah 528.4 billion, and which in 2016 was 16% of our total healthcare expenditure. Okay?
Right. And that's medical errors, excess medical costs, all the classic
everything, drug interactions, taking too much, not taking enough, all the gamut, right?
Right.
And ending up in the ER, all these kinds of things.
Mm-hmm.
So the thing is that, when you look at all the different healthcare providers, pharmacists, we either get a 2-year or 4-year undergrad, right? 2-year pre-pharmacy or 4-year undergrad. And then we do a 4-year doctor of pharmacy degree. And then some of this postgraduate residency training, and all we're focused on is how medications work in the body and how they interact with each other, and looking at and we've brought into health promotion disease prevention because, right? Look at who, when the pandemic hit, right?
Right.
And all the clinics, everything was closing. Who stayed open? The pharmacies, right? And 100%. When it came time,
good point.
Right? We're immunizing folks, and the pandemic has even opened up more opportunities. We had some in some states we were doing some point of care testing and things like that, but with the pandemic right now we're doing COVID-19 testing, and then recently they said, okay, now we can even administer the COVID-19 therapeutics. So really during this pandemic, I would say that pharmacists are among the heroes. That neighborhood pharmacy staying open and keeping essential services. So when you say like, what does APHA do? The thing is that in the 60s, when they were coming up with the Medicare Act, do you know that pharmacists were left out as providers?
Right. Wow.
So what that has resulted in is that pharmacy is paid for product, not service. And we have so much we can contribute to ensuring, to improving, to optimizing medication therapies and a more holistic approach to care and all that, but we're not compensated for it universally, so then they can't staff accordingly, and we can't offer that, and so who's suffering? It's our friends and family, so that's really what APHA is doing, is advocating for pharmacy. And APHA was very instrumental in a lot of these things that I said, these doors that opened, advocating for pharmacists during the pandemic to have this broader authority. And I would be remiss if I didn't mention that there are state-by-state efforts as well as national efforts, where in some states pharmacists have provider status, and it has allowed a range of different things, but it's not equal in each state. In some states, it could mean that there's little prescriptive authority, maybe certain things like nicotine replacement therapy, or there's even in Idaho where you can prescribe, cholesterol medicine. So there's different things, but yeah. This needs to change, right?
Yeah.
Because we've got the medication expert, the one person that could really help, because it's great to diagnose, it's great to prescribe, but then what? And really this gets us back to the digital health conversation, because that's what, this sensor-enabled therapies and, digital biomarkers, all of this is really looking at that kind of continuous data and being able to act on it. So I think there's a huge role for pharmacists.
I mean, you kind of been alluding to, in the community pharmacy, obviously pharmacists are online through all kinds of different services, right? There's a lot of virtual services that are launching that pharmacists are front and center from, conversing with consumers, et cetera. So in a way, and I'm going to say this, right, because everybody wants to be the, the front door to health. I do see that pharmacists are playing that huge role, right? Knowing and understanding the patients and the health consumers, whether it's at a local CVS or a mom and pop pharmacy or online. Talk to us how you're thinking about this. I'm sure you're going to say yes, but why?
Well, pharmacists have always been the front door. Like we were saying, I see us as kind of the port of entry, because you don't need what other, healthcare provider, you don't need an appointment. You just step up and, and start chatting, right? So kind of, we've always we were already society socialized to seeing us in that role. And I think that, now what's key is, that's fine, virtual first, I'm all about that. The other day I needed a doctor appointment, and we've recently moved, and I was going to have to drive an hour to get to my doctor, but I was like, this is just a conversation. I did a telehealth visit from my kitchen. It was awesome. Completely a better patient experience, right? So I would just say that I see pharmacy evolving and being part of this. Because we all know, right? It's not that digital health eclipses traditional care, right? It's one augments the other. And so I see that for pharmacy as well. And I think, if I may, Eugene, I'm just going to step back a minute. I think another Achilles heel for us, not only has it been that we aren't the way we're paid, right? But the other has been, I would say, the fact that we're still counting pills. Such a waste of human capital. When I travel around the world, every other country I've been to, whether it was, I was in Abu Dhabi, it was like this. I've been in Paris, I've been in Tokyo. I mean, it doesn't matter where I go, they just open a drawer and hand you, it looks like an OTC product, right? It's a pre-packaged
blister pack.
You're familiar with this, Jim, or it's probably like that in Ireland.
Right. It's blisters, yeah. It's blisters, yeah. Totally.
But why in the US do we still have these stock bottles, and we have pharmacists and pharmacy technicians, and there's some automation, but by and large, our neighborhood pharmacies are sitting there counting by fives.
I feel like even like and I think what TJ Parker did with PillPack, and I think he was wasn't he the son of a pharmacist?
Yeah.
And
he's a pharmacist, yeah,
he's a pharmacist himself, but it was fascinating, because a lot of that innovation, or that first part, at least the manifestation that I saw, was like just organized pill. It was like they were sending you it in effectively a blister pack, but it was, that was one of the big innovations, which was kind of not that new.
Well, and what, and I have to say this for my other pharmacist friends who, and the millions that are watching, right?
Right.
That, blister packs and stuff, we've all been doing that, not all. Many have been doing that kind of thing, but my hat goes off to PillPack, because they really put a whole marketing solution around it, and also I think by then Amazon buying PillPack, then now you get kind of like huge awareness on what's possible. And here's my thing, and I'm just, again, remember, I'm speaking just Risa's opinion, not representing the organization.
Risa. This is Risa.
Always.
This is Jim.
But this is what I'd like to see. I'd like to really see that as we do have digital pharmacy popping up everywhere. We've got, and Hims, Her, Row, Capsule, Alto Pharmacy, like all these different, things that are out there. What I'd like to see is that it doesn't mean that we're then closing our neighborhood pharmacy, right? It's just we're reinventing what it means when you visit that neighborhood pharmacy. So think more Apple Store-esque, right? It's a place where you have health solutions, right? So we would go in there, and hopefully, like, your chronic meds are being sent, a nice experience, to your home, but maybe some acute therapies that need to. But gosh, the way companies like Fox Health are getting things out to you in an hour, maybe even for the acute therapies, those could be delivered. So we'll see how that evolves. But then when you're there, I'd like to see the pharmacist role being matching individuals with medication plus the digital companion. Right? Because, and so why am I a digital health enthusiast? Because, wow, there's no mystery now, right? Pharmacists are always looking to, how can we help people with, to better understand. Nobody wants to just, I'm going to swallow this pill. What they want is, they want to be able to be at their daughter's graduation. They want to be able to feel good with
the outcomes, the control, the agency over their care.
Like, connect pill with how you feel. Well, now with like sensor-enabled inhalers and biodisposable sensors for pills and all these different things, smart insulin pens, all of that. So now, there's all this data, and we're actually helping health consumers to be more educated about their care. They can actually make the connection. Oh, I take this medicine, this is how I feel. And then if something goes off, getting these little nudges through these different apps, these different, things I think are fantastic. What I would hope that the pharmacist is right there, the front door, right? So digital health companies, think of the pharmacist when you are designing these products. Think of us in this ecosystem. We can identify a patient. Oh, patients on an opioid has opioid use disorder, and they're on buprenorphine. Right. The pharmacist could say, this person could benefit from cognitive behavioral therapy. Why don't we prescribe Reset Out?
Right. Yep. But we're in this fantastic era of dilemmas, right? Like where, like in Ireland, for example, all of the medications that are shipped by specialty pharmacies in the U.S., you have to collect from a community pharmacy, and the community pharmacists hold on to that, and then probably less kind of corporatization of pharmacy in Ireland. So you still have Boots and some of the bigger, a few of the bigger ones. So some consolidation, but still lots of community pharmacies, just like you're talking about. And but having to go, so it's this one dilemma of like social isolation, me walking into the pharmacy, collecting my medication, having a chat, seeing what OTC products I bring up, I need to buy, what challenges gets them closer to me, to my care, whoever I'm buying, versus sending it, or, and then it's the isolation, right? Like it's the, like, don't take away my pharmacy trip, like right now, I kind of shed a tear when I go to buy a newspaper on Sunday and there's none there, because I just kind of like the little event of going to the stand and getting a newspaper. It's gone now, So it's this dilemma, right?
Well, so instead you go get fish and chips and wine with Marty and team. Why not? It's a good trip too.
It's not going to be one or the other. I think it's really, we're moving forward with hybrid, right? So it's how is it that you want to receive your care, right? Do you want to go in? Do you want it to deliver? Do you want to have a virtual visit? Do you want it in person? Or is it going to be a combination depending on what's going on? I really see it's evolving in that way. The ATA says, right, telehealth is health, right? So it's just going to be, kind of what we're doing. But really like looking at pharmacist role. Again, if we have so I can see us matching patient with medicine plus digital companion, right? Also, maybe folks aren't as savvy. They okay, how do I download this app? Okay, how do I set up this wearable? Okay, how does this work? So, helping with setup, right? That's kind of a nice in-person opportunity.
Right.
But this very, very important is that as they're designing these digital therapeutics, digital medicine, all those different things, we want pharmacists to be able to be part of seeing the data. We're part of that loop because we're wired for that, right? I know that all healthcare, like physicians are always like, oh my gosh, more data. What am I going to do with this? We really want actionable insights and all that. Well, guess what? The pharmacist, that's what we went to pharmacy school to do, is you've got that, you're on this medicine. How do we optimize it? What's going on? So if we could see patients' insights that they've, entered in there, or like different kind of labs, different things, or how they're taking their medicine. And we are part of seeing those little, like, for example, like Propeller Health or Teva, we have a portal that says, oh, the person's like overutilizing their albuterol inhaler, or they haven't taken their, their maintenance inhaler. The pharmacist could be part of that. And I know there's electronic badges, but what about that in-person relationship as well, Todd?
No, I love that idea. I mean, like what a grand vision, the idea that you would go into the pharmacy and say, hey, listen, I'm on this medication. What digital companions are available to me so that I can tackle my rheumatoid arthritis or diabetes or, whatever condition I'm trying to treat. It's lovely.
I know, Risa, you and I kind of touched on it, and this is my sort of passion point around digital therapy specifically. And, the pharmacists, once again, are in the front lines, right? When a regular pills get prescribed, you're fronting a lot of the questions and even to a certain extent care, right, of that patient and right in front of them. Digital therapies, I think, are the same thing. And the question to me is, are pharmacists ready? Is there enough education? And I think some of the stuff that I know you're trying to pull together, from conferences to speakers to et cetera, to educate the community. So maybe talk a little bit on that intersection of pharmacy and digital therapies, and how do we get those 300,000 plus pharmacists educated around it.
Yeah. No, thanks for asking that. Yes, I am a self-appointed champion for digital health integration in pharmacy. And yeah, I've been going full steam for a few years now on this. You know what, can I just tell a fun story about like what the spark was for me?
Yeah.
Totally.
And I think I know the people that
know
you're gonna call out.
Yeah.
Go for it.
I think it's because you just never know who you're sitting next to, right? And how one little spark could just like create this whole cascade of events, you know? So it's just, so it's 2012. I'm at a Pharmacy Quality Alliance meeting in DC, and I haven't paid attention to the agenda. I don't know who our keynote's going to be over the lunch hour, right? And I'm just chatting. There's these beautiful round tables, tablecloth. We're all eating lunch and chatting, and there's somebody sitting like one over from me, and he seems to really loom large. He starts talking about 3D printing medication and what do I think about a super pill, does foster adherence, the therapies, and all this. I'm like, gosh, who is this? You know, this is really innovative kind of pharmacist. But then it turns out, nope, he's a physician. Anyway, I think it's right around the dessert. They're handing dessert out, and we're kind of waiting for the keynote. And the CEO of the organization goes to the podium. She announces the keynote speaker. The person I've been talking to all along rises to his feet, takes center stage, and we're all spellbound. Right. It was Dr. Daniel Kraft.
Okay.
And was he in 2012? Because I met him a little later. Was he also like bullet fast as far as his present?
I promise you, faster.
Okay.
We were dazzled.
You slow down. Yeah.
And he had, you know how he has all these little gadgets, and I'd never seen any of these before. So like he's put things around his wrist and a little, something out of his pocket, and all of the these gadgets, and he's
like a magician.
Yeah. No, he was designed to be a digital health communicator, spokesperson, prophet, whatever you want to call him. He was designed.
Yeah. And I've never been the same since, because I just saw, wow, what was possible, and we would have, because up till now, like, if you think about medication, we're just basing, like, if somebody's taking, so physicians think the patient took the medicine because they prescribed it. Then the pharmacy says, no, they never picked it up. Then, the pharmacy might think, oh, we know they're taking their medicine because they picked it up, right? But then what do our home health nurses tell us? No, they are stockpiling. They just don't want to have anybody. It's on autofill, so they're just accepting it, or so really we're going to, with bioadjustable sensors and digital inhalers and all these different things are just like, it's just going to transform, really knowing, how good, and really getting at why, so to help people understand like how taking therapy. And I know I keep talking about medicines. My mom says I'm such a strange pharmacist because, when I have a headache, I just push on my pressure points, so I'm not saying that medicine's always the answer, right? When moms would come into my pharmacy and they'd show me their little toddler with a runny nose and they're saying, which medicine is it? I would say, you know what, how about just some Kleenexes? Because really, if we give you this medicine, maybe they'll get rowdy, like give them a little Benadryl and they'll be like,
but we live in I'm a believer in medicine, like, and I know you don't want to overuse it, but it's like we live in a phenomenal time for how they affect your biology and what it can do, and we're all witnessing it. So totally, it's big. But
a healthy lifestyle first. So go ahead.
No. I was gonna say just I'm the timekeeper, if you've seen. So I want to make sure that we're. I want to talk a little bit about the conference that you've been putting on, and then we'll probably just go to Jim's famous question after that.
All right. So basically in, I guess it was sometime in end of 2018, beginning of 2019. And as I was talking to a lot of our thought leaders in pharmacy and folks in the front lines, I realized that digital health is really a blind spot. And I recognized that, so I felt like I need to make sure, because pharmacists got left out of the whole provider status thing. This is once again a place where we can really contribute to that non-optimized, remember that $528.4 billion, we can really contribute. And if we get left out of this, it'll, society will suffer. So what I did was I invested in myself, and I started going to conferences like Health and Exponential Medicine and the HIMSS local chapter and Singular University's Global Summit, like just whatever I could go to just invest in myself so I could learn and build my network. And then it was through my volunteer volunteer leadership role with the California Pharmacists Association that in October 2019, we convened DHX, the first of its kind digital health conference for pharmacists. And awesome. My superhero, Daniel Kraft, was one of our keynotes. And it was just really humbling after this day and a half live, conference. People were coming up to me and, they were saying things like, this was eye-opening, career-changing. This wasn't just a conference, it was the beginning of a movement. And they said they want more and they don't want to wait a whole year for another conference. And so I started again through my volunteer role, a digital health corner, a newsletter. Would love to have a Jim or Eugene article sometime, but the idea was to incrementally.
I was going to say not both in one article, just because we're never going to coordinate anything aside from this. So.
Yeah, so we have those monthly articles to incrementally increase pharmacists' knowledge in this space. Anyway, and then the tagline was the future is now, join the conversation. And we realized how prophetic that was because just a few months later, it was, the whole pandemic. And suddenly where in 2019, people were like, telehealth, what's that? Remote monitoring? Right? It was a household word. So then it was super exciting that in 2020, October 2020, I again created a new conference, this DHX virtual, and it was over 3 days. And as I was talking to Eugene, I always like to dream big. So I was like, okay, I'm going to have, and so look at who these speakers were. So it was over 3 days. We had 27 states and 4 countries participate. We had folks like, of course, Daniel Kraft again, and Tim Aungst, who's the digital apothecary. You should have him on the show. He's another.
We should, yeah. Last time I connected with Tim was on like Clubhouse or something. I don't know. This was ages ago.
Yeah. Another time I'll tell you that origin story. The first time I met him, because that was really instrumental in the work I've done. He's been on this journey. I've been on the journey with him, really. But we've had him. And we had Lisa Suennen on our virtual stage, and Dr. Jenny Schneider, and Randy Parker, right, the former founder of MD Live, and now Genius Direct. And I mean, it goes on and on. I was just humbled by the folks who said, "Oh, we had Jen Goldsack, right, executive CEO of DIME, of Digital Medicine Society, and of course Megan Coder." He was the former executive director of Digital Therapeutic Science and still on board there. So really just an all-cast group of folks. And so what was the idea? The idea was that we've been innovating in pharmacy forever and a day, but I found that pharmacists, even our top thought leaders, this was a blind spot for them.
Right.
And then I know that there's all these digital health innovators, right? And they don't necessarily have pharmacists as part of their design team. And I think pharmacists as domain experts, part of these health and technology companies needs to be top of mind, because if you're doing anything that's for health and you not have the pharmacist on it, right? So I think that needs to be, so I wanted to have them on the virtual stage, communicating together, presenting together, hearing from each other, that it would really catalyze. And what happened as a result, I'm delighted to share, is that it catalyzed individuals and institutions for next steps. We have a student who started a Pharmacist for Digital Health chapter on their campus.
Wow,
so now they're bringing all these new speakers and really bringing that information to their campus. And then after that, my day job, the American Pharmacists Association, said, "Oh, wow, you're doing a lot in volunteer. Come do it for us." So this year, I convened digitalhealth.rx, APHA's inaugural Digital Health Summit. And also, I've been on the planning committee in October of this year, the American Association of Colleges of Pharmacy. We're going to have our first Digital Health Institute with them. Why is that important? And why would I want your millions of audience members to know about this? Is because the idea is that we are inviting all pharmacy schools to send a cohort to go through this 2.5 days institute to learn about digital health and how to thread it into the curriculum, co-curricular, and postgraduate training. So what we're going to start doing is graduating the next generation of pharmacists who are digital savvy in this way. And
we'll include a couple of hours on health coaching as well in there.
Yeah. Absolutely. That's a good. Oh, and I want both of you. Okay, you're already invited for our next conference.
Yeah, I love it.
You can zoom in, maybe physically as well. Who knows?
Yeah. And who we had at this year's Digital Health Summit, the one with APHA, is Jen Horonjeff and Grace Portovano, right? So
great folks. Love it. You want to go to your? I'm the time checker.
Yeah, I feel like there's an army.
Yeah,
like there's an army, she's coalesced an army of pharmacists that are going to revolutionize digital healthcare and I'm picturing companion app stands coming up inside community pharmacies all over there. I'm totally pumped about this revolution you started here. The pharmacist revolution we've got going on, right?
I love it.
Yeah.
Can I comment since you said the word revolution? So
100%.
at our digitalhealth.rx summit, APHA's conference that I led in March, we had the Glenn Tillman on our stage and the Ritesh Patel. So I asked Ritesh to do the fireside chat with Glenn. And on our virtual stage, Glenn said that he believes that pharmacists can lead the digital revolution.
I love it.
All right.
No better man. Ritesh and Glenn, that's a power match, right?
He was the OG fireside chatter.
Yeah, exactly.
Yeah, and then Eugene, you just were speaking with him.
That's right.
So
that's right.
Awesome. I watched that too. Fantastic.
So Risa, picture yourself a pharmacist trained. You're just out of school. You went to this amazing digital health conference. You got so inspired that you decided to volunteer on an Indian reservation or a Navajo reservation. Sorry, and you're on there and you came up with this phenomenal idea of a digital companion app to help people with tobacco withdrawal. So you've got this phenomenal idea and you're looking at this young entrepreneur that has this company and they want to launch it into community-based pharmacies. What advice would you give this young entrepreneur looking at them right now?
Yeah, I like that. Jim. I love it. Yeah. What's that?
I was saying, wow, Jim, that's impressive. That's a very thought through question.
No, that's really impressive. And maybe you saw that I'm a tobacco treatment specialist. That's why you trained at Mayo. Yeah, I volunteer at UCSF. Yeah. So you do your homework. Well, you know what? Really, I think for any new young entrepreneur pharmacist, I would say that do practice. Work in a community pharmacy, work in a hospital pharmacy, because nothing is going to replace having actual hands-on experience caring for patients and working within our current healthcare ecosystem. Because I think, if you skip that step, then you're always just depending on others for those insights, and you're going to continue to get insights from others. But I think when you walk that walk, then what happens is the ideas you have are very practical. They're very practical. They're very, and they integrate into the workflow and all that. Yeah, so it's just not too pie in the sky. So if they want, they can be doing. There's plenty of folks who they work for pharmaceutical industry, but they still work a few weekends a month in a community pharmacy, or they're faculty. So it's not that you can't do both. So that's the kind of neat thing too. So one thing is, don't skip working in the pharmacy. So I want them to do that.
Feel some of that pain and joy at the same time, right? Helping individuals.
Yeah. You can be innovative. Well, I was talking with another innovative physician, and he continued to work. He was working on his digital health startup while he was practicing, and it was just such a source of ideas.
Exactly. Well, Risa, thank you so much for joining, and we appreciate it. And for all of those listeners and viewers, just hit the subscribe button, pass us on.
Awesome.
This has been an absolute pleasure.
Thanks, Risa.
Cheers.